Good afternoon. I'm Dr. Archana Shetty, breast oncosurgeon at Kokilaben Ambani Hospital. Today I'm going to be talking about breast cancer awareness, and I decided to pick up 10 common questions, frequently asked questions, FAQs, that we get asked by patients about breast cancer. So first question, usually patients think that breast cancer is a disease of the West. So they ask me how common is breast cancer? Is it really that common in India? And my answer to this is yes. It used to be thought a disease of the West, but it is getting more and more common in India. And what we have noticed is that given the inaccurate statistics, but in spite of this, we know that 1 out of every 22 women in India will get breast cancer in their lifetime. Then the reasons for breast cancer. Another common question is, what are the causes for breast cancer? Though we cannot pinpoint what the exact cause of breast cancer is, there are certain predisposing factors for breast cancer. One is increasing age. We do know that postmenopausal women after the age of 50 have a higher incidence of breast cancer. Saying that again, we see a lot of younger women with breast cancer in their 40s and 30s as well. Previous history of breast cancer, anyone who has had breast cancer in the past is always at a slightly higher risk of developing breast cancer in the future. Anyone who has had previous radiotherapy to the chest wall as a child is at a higher risk. Strong family history. By this, I do not mean a great grandmother who has had breast cancer, but first or second degree relatives. So mother, Mausi, sisters, if they've had breast cancer, especially at a younger age, this puts the female at a slightly higher risk of developing breast cancer. Genetic factors, you may have heard about the BRCA genes, the BRCA1, 2 genes, which if someone has got, puts her into the high family history group. Hormone replacement therapy taken for a very long time. By very long time, I mean maybe 10 years or longer, then yes, that does put the woman at a higher risk of breast cancer. Women who have not breastfed, not had children, again, they are at a slightly higher risk. Then the next question is, what is being breast aware? We talk a lot about breast cancer awareness, so women ask, what does being breast aware actually mean? So what I like to explain it is in a 5-step rule. Basically, we look after our hair, our body, but none of us actually have the time or bother to look after the breast. So there is a simple 5-step rule when you talk about being breast aware. One is, it's about mainly self-examination. So the first rule is know what is normal for you. Second is know what to look for. What are the signs of abnormality when you do your self-examination? Third is, if you do, how do you examine yourself? That is the other thing. Fourth is, if you do notice anything abnormal, please go to your doctor, your general practitioner, and report it. And fifth is, if you're over 50, do go for breast cancer screening. Those are the 5 important things of being breast aware. Then comes the question of, what do I have to look for? What do I know? How do I know if something is abnormal? Because I do not know how to examine myself. So the first thing is self-examination. Don't do it too frequently. I would not recommend doing it daily or weekly. Just once a month. You can either pick up first day of the month or the 30th of the month. If you are getting your periods regularly, then yes, about 4 to 5 days after the period, that's the best time to do it. If you're in the shower, that's the best time again, because you have a mirror there, and do the self-examination. First, look in the mirror, lift your arms above the head. Do not touch, just look in the mirror and examine yourself both sides. Look at the symmetry. If you do want to, and then the next step is palpation, which is examining with the flat of your hand. Again, when you examine yourself, if you're examining the right breast, make sure you raise the right hand above your head so that it stretches the right breast, and then examine with the left hand. The same goes to the opposite side. And do not forget your underarms and above your collarbone as well. So what are the abnormalities that you're looking for? First is any obvious lump, which can be a pea-sized lump to a tennis ball-sized or a big lemon-sized lump. Flattening of the nipple, any asymmetry, so difference in heights of the nipple, thickening of the skin, dimpling of the skin, like how you get dimples on the cheek, in the same way you can get dimples on the skin of the breast as well. Any spontaneous discharge, especially if it is blood stained, eczema like rash around the nipple, all of these can be signs of breast cancer. Lumps under the arms and above your collarbone as well, do not forget that. But do not panic. Most of the times, more than 90% of the times, if you do find anything abnormal, it will turn out to be benign, which is non-cancerous, but you do not know that unless you go to your doctor. What if you find something abnormal? Yes, please do immediately report to your local general practitioner, and if they are worried, they will then send you over for further tests. Then how frequently should, the next question that they ask is, how frequently should I have a mammogram? If you do not have any symptoms and if you do not fall into the high family history group, then once or twice a year after the age of 50 is sufficient, a mammogram. If you are younger, we do prefer a good ultrasonogrammogram, which is a good sonography in the hands of a good radiologist. But if you fall into the high family history group, which your doctor or your breast cancer specialist or your gynecologist can decide after going through the detailed family history, then yes, you do require frequent screening starting 10 years before the index case. So if the mother has had breast cancer at, say, 38 years of age, then the daughter should start screening herself from 28 years onwards. Then the next question is, how do you treat breast cancer? As you all know, it is not one treatment by itself, and it also depends on the stage of the disease, the age of the patient, how fit she is, but usually it is multimodal treatment, a combination of surgery, chemotherapy, radiotherapy, and hormone tablets as well. It is different for each patient, so please do not compare yourself with your neighbor or the other person in the chemotherapy ward. It all depends on individual patients. And there is targeted chemotherapy as well, which again is your doctor will explain to you in detail if someone does need targeted therapy. The next question I get asked is, suppose I do have cancer, do I have to have the whole breast removed? Now the treatment of breast cancer has evolved a lot over the last 20 years, and the answer to that is no. We do not recommend removing the whole breast. In breast cancer, we now have a saying, less is more. So we used to do a lot of extra surgery, which was not necessary. Now just taking off the lump is more than enough. So in majority of the patients, it also depends on the size of the breast, size of the tumor. Even if the tumor is large, we can give them chemotherapy to shrink the tumor and then operate and just take out the lump. And we also do not need to take out all the glands from under the arm. We do what we call as a sentinel node biopsy nowadays, which means taking out only 1 or 2 nodes and testing them. Only if they have cancer do we need to take out the other nodes. Another question is, if I come in for surgery, how long do I need to stay in hospital after surgery? The answer to that is, it can be done as a day care in majority of the cases, or staying in one night and the patient goes home the next day. And because, as we all know, the recovery at home is much quicker when you're surrounded by your family in your own bed, using your own bathroom. Recovery is quicker, cheaper, less painful, and infections are also less. Final question, can men get breast cancer too? And the answer to that is yes. 1 to 2% of men can get breast cancer, though it is very rare in men as compared to women. They also have to be aware, and the treatment is the same, the diagnosis is the same, everything. But unfortunately, men present to us at a much later stage than women because it is so rare, it is not picked up easily and they do not flag it up easily. Thank you very much. These were the 10 most frequently asked questions that patients present to us, and I thought just going through that would help. And if you do have any questions, please contact us or your local doctor. And remember, be breast aware, be breast cancer aware, because early detection saves lives. Thank you.